Thank you, Dr. Fikri. Good morning, everyone. I like it that the color concept matches my tie. Thank you so much. Yes, so welcome to Sunway University. For those of you who have not been here, hope you have some time to walk around the campus and go check things out. Anything you don't like, please give us any feedback. Right, now, disclaimer, first of all, is I am not an expert in cancer. Trying to reduce my stress now. Because this is a cancer conference, I'm supposed to be an expert, I'm not an expert, right? Because my area of research is not in cancer, even my area of clinical work when I used to practice, I no longer practice, so please don't send anyone to me. I'm more of a referral service these days. I get tons of phone calls every other day, people wanting to see me, but I have to refer them on to other psychologists. So I'm a clinical psychologist by training. I'm more of a cynical psychologist by profession. It's more fun to be cynical. Yes, so my role today is more of an advocate. I am advocating. I don't need to be an expert to advocate because it's a very, very important topic. But I have done a bit of my homework to ensure that you get information from the experts. So that's what I'll be presenting to you today. My topic, as you know from the program, is psychosocial components of multidisciplinary cancer management beyond just mental health. Why beyond just mental health? Because normally when you hear the word psychosocial, psycho already makes you think, mental, all right? And the thing about the word mental, right, it's got such a negative connotation, negative stigma, that anything you put mental with becomes negative. Even if you put mental in front of health, health becomes negative. How many people when I ask, would you like to hear talk on mental health? Oh, no, I don't know mental health. No, mental health. I say, if you don't have mental health, means you got mental illness. Oh, no. Right? Mental in front of health makes the whole thing sound as though it is illness. And we know very well that health and illness are two different things. Yeah, maybe there's a continuum, but being healthy is not being ill. But once you put mental in front of it, everything becomes illness. So I purposely want to talk about psychosocial in a way that makes you think about behavior, think about social, think about emotions, not just in the person with cancer. And it's not just about the person with cancer having mental health issues. There are so many things going on as well that is not necessarily mental illness or focusing on mental health problems. You're looking at psychosocial, psycho meaning psychological. Psychology is a very broad topic, very broad subject, and it's not just about mental health. So that's my main point. In case you all fall asleep after this, at least you get my main point. Alright? Yeah, early morning joke. It's still early morning for me, I'm not a morning person. So I need to joke to stay awake. If you stay awake, that's fine. Now, cancer management, what do we know about cancer management? I know very little about it, although I have family members here and there who have had cancer, who have survived cancer, who have died of cancer. Cancer is that common, isn't it? Firstly, we need to go through assessments, and then there's diagnosis. Every step of the way, there are psychosocial elements. Assessment, some people are so scared to go for assessments. We had a bus, is it still there? A bus there to screen for lung cancer. How many people actually went for it? Do we know? You went for it? Me too, high five. Clear, huh? Lungs clear? Yeah, mine also. Lucky. But that's the thing. Why do I say lucky? Because if it is not so clear what has to happen, we go for more screening and more testing and more testing. The whole process to even think about wanting to go for a test is anxiety provoking. It manages your behavior, your motivation or demotivation. At that stage also, it's really very much something we need to bring in psychosocial elements because we want to promote screening to have more early detection and better management of cancer after that, right? That is psychosocial. How do we address that? Then there's the diagnosis part. That's the part where people suddenly see their whole life flash in front of them. Cancer, the term, is such a strong term that the diagnosis comes with a belief that it's, life sentence. But we know that is not necessarily true, right? Cancer is treatable, and more treatable when it is detected early. So how do you address that? Treatment alone can be quite an ordeal, depending on your attitude. Attitude, highlight that word, attitude. Attitude is psychological, right? Attitude is something that breeds your behavior. Behavior is psychological, right? There are so many elements that is psychosocial that is within treatment. And treatment is not just about even diagnosis, assessment, diagnosis, treatment. It's not just about the individual who is affected with cancer. It's also their family, their friends, right? The caregiver, the healthcare provider as well. All these people in a system, as a system. And if you just only focus on that one person, you're missing out the whole point about how the system is. How the person behaves and motivates depends, and it is all motivated, depends on how the system is. If you don't provide easy access, less motivation. You access already, but they scare you with all kinds of stuff, then what's going on? So psychosocial elements are within the whole system rather than just the individual person who has cancer. So we need to think as a system, and that's what I would like to encourage all of us to do. And of course, impending death, cancer diagnosis, it just alters your whole existential thinking. Your existence is a threat. That changes your motivation for so many other things. How do we address that? How do we address it not just in the person with cancer, but also in their family members, friends, and all, because again, it is prejudice. Cancer means automatic death, that kind of thing. But we know through all kinds of research, it's not true. Alright, okay so far? I just want to paint that picture for you. And what about practical issues, day-to-day kind of issues that tend to not be brought up in conferences like this or in brochures? These are the little things that can really improve quality of lives in families dealing with cancer. So I just put out there the balloons, what are the processes, resources, responses of not just, again, the individual, but the people around them. What will be their experience? How's coordination done? Often things are disjointed, and that's where families feel desperate and don't quite know what to do. You go to the hospital, who do you see? Doctor, nurses. But do these people really have time to go through and walk through with you about what things happen? Sometimes here and there, but generally no, because there's so many patients. Who can do that? Who are the people who are involved in providing you to fill up that gap? These are the things that we need to think of as well, because it's not just, some people say, oh, counselors can do that. Do you have counselors? Are counselors trained in a clinical setting? Not quite. Not necessarily. Counselors are not trained to work in a hospital. Most of them don't quite know much about medical issues, so they need to be trained. And this is where I'm shameless about promoting Sunway. We are coming out with a clinical mental health counseling masters so that we can equip counselors to know how to work in the hospital. Anyway, not just counselors, social workers, there's so many other people we need to mobilize. Are we using them enough? Do we know about them? So these are something to think about, because psychosocial, the social part involves people. How do we mobilize all these people, coordinate with them to provide the best service we can give? Right, now, why psychosocial? I think I've given you already. I prepared this some time ago, I forgot what I'm talking about. Because the main drivers of recovery and quality of life are two things. Three actually, I don't count very well. To me it's 1, 2, 3, many. So yes, please take a picture. You want my slide, I'll send to you, no worries, free. But you sell in Pasar Malam, I get 10%. Behavior change, attitude change, these two are the very strong drivers for any form of recovery. Not just talking about cancer. And of course, positive social engagement. This is something that I did preparing for this talk. I read as quickly as possible updated research literature on the main factors contributing to good recovery. Positive social engagement, basically anything you do that improves quality of life. And we know from longitudinal research that if you want good quality of life, people say health is wealth, right? Actually, research does not support that very much. Social health is wealth. It's not your mental health, it's not your physical health, it's not even your financial health, although to a lot of people financial health is very good wealth. Your social health. And this is why each time there's an orientation, at uni, I tell the new students, first thing you do, make friends. Keep on making friends. Because you'll lose some along the way, especially when you do group assignments. Yeah. And that's how it is. You look at the people who live longest, and even if they don't live longest, had the there goes my English, the best quality of life, are those who actually have good social support. Right? Medicine, yeah, medicine is important, but medicine manages the symptoms. How do you help people to get better? That's where psychosocial comes in. Alright? Now, why this topic? This is a very, very populated slide. So this is not the way you do slides, so don't follow this kind of example, very bad. But I'm just hoping you would quickly read. Why this topic? Because any form of cancer care involves significant psychosocial variables. I just told you that. Lifestyle changes are very necessary. As soon as you get the diagnosis, you need to prepare for lifestyle change. It is drastic. One of the most drastic things, of course, is finances, because treatment is not cheap. Right? Even if treatment is there, sometimes you have to wait. Transport, you got to think about all kinds of changes in the family just to facilitate treatment. So these changes, of course, need all kinds of changes as well. Attitude, behavioral, social, economic change, so many things. Change in itself is very stressful. How do you manage the stress that comes with change? That's like double stress. Involvement of psychologists in cancer treatment is not just about mental health, like I said earlier. It is also about behavioral, cognitive, emotional, and social adaptation. How do you help people adapt? And that is not necessarily to treat depression only. Even in depression, also the treatment involves adaptation. So the talk, I know I've just been told I've got 10 minutes left, just about to start the talk. Oops. What to do, professor? Lecturers talk a lot, senior lecturers talk even more, associate professor talk really a lot. Professor means you're not going home. Sorry, I miss you will have time to speak. Next speaker. So brief overview of how you can change behavior, psychosocial needs, and can be actively addressed. You don't just wait for it, you actually start doing something. Right? So, since it's usually about mental health, let's talk about mental health first, just quickly. When it comes to cancer, this is what I learned also in all my readings. The top two emotions that come out early on is depression and anxiety. And depression and anxiety normally we attribute to the person feeling it. But actually, there's much more than that. It is your biology. If you are predisposed genetically to be depressed, you are likely to be even more depressed than most other people. So it is individual different. You cannot say that everybody goes through the same kind of depression. No. Some people are quite chill about it. I've met people with cancer whom you don't even know is going through cancer because they're so chill. Until they tell you it's cancer. Yeah? Or until they actually die of cancer. Then you go, dead already. How come? Oh, got cancer all this while, these 2-3 years have been having cancer. Never knew, because attitude to life is just so positive. Didn't even need to see a psychologist. So again, it depends. Psychological depends on how you go through your personality, what you learn, how you learn, are you able to learn, all right? Psychosocial, the social part, the spiritual part, and environment. So all these things I won't go through into so much. Now, I just want to mention Dr. Daisuke Fujisawa because he's my friend who's the actual expert in psycho-oncology. When I was told that I was invited to give this talk, I panicked and I went to him and said, Daisuke, help! And immediately he sent me points that I'll be sharing with you. So ta-da! Not an expert, but I'm bringing an expert here. So he says that there are many guidelines, new guidelines in 2023. Anderson et al., Grassi et al. Says that psychotherapies are recommended over pharmacotherapy. It's like, whoa, really? That means non-pharmacological treatment first when it comes to dealing with psychological issues. That's quite a big thing, isn't it? Suddenly doctors don't feel very happy anymore. Sorry, doctor, but this is important also. Says the guy, not me. And because there are more solid evidence and less adverse effect than pharmacotherapy. So try that first. If you're interested, please read these two. You can find them. Or let me know your email, I'll email them to you. You can find on Google Scholar also. And it is also important to explain very basics of these psychotherapies to people, to also the healthcare providers. Anyone can do it. You don't really need to be a psychologist, but you can learn the skills to provide this kind of support. And that's where psychosocial support comes in. Right? Too many people think, that's for psychologists to do. There are not enough psychologists lah. Not enough counselors also. How many do you know, apart from me? Don't know, right? So you learn the skill. NCSM also not many psychologists. How many? 3, 2. That's already a luxury. That's a luxury. In some hospitals, none at all. All right. In KKM, how many? 30, 34, around that. Yeah. Serving a country of 34 million. How la? Cannot. Anyway, back to this. Right. So general public and basically is to educate about psychosocial needs. And the conceptualization of cognitive behavioral therapy for pain is something that has been found to be very, very helpful in cancer treatment and managing cancer recovery. Not just about treatment, but recovery. Once you've recovered already, there's still work to do, right? So how to manage CBT, cognitive behavioral therapy? I know in Malaysia it's a different thing. It's criminal breach of trust, but in the medical line it's cognitive and behavioral therapy. This is gold standard. It's been found to be really helpful, so it will be very helpful for healthcare providers to learn this, right? Normally clinical psychologists are the one trained in it, so go learn from them. Concept of mindfulness also, later on I'll just share quickly on a mindfulness paper by Carlson especially. This is a very good paper to show you how effective mindfulness-based intervention is in cancer treatment. Really good. Now, okay, another very popular slide. This is guideline from Anderson et al. I won't really go through it so much, but again, I'm happy to share my slides with you. This one you can just read and I hope it makes sense to you already. So, step care model. If you are not too severe, do this first. A bit more severe, do this first. And the first 3 steps, if you notice there, are all psychological, are all psychosocial, not even pharmacological. Only the last step where you really need the medication, yes, then put medication. That's the whole idea of step care. And what do you do in terms of managing depression and anxiety? BA is behavioral activation. You know what behavioral activation is? It's one of the best things you can do for any kind of psychological problems. Do it first, and this is where you can bring Nike to come and sponsor you. Just do it, come on, let's go. Do stuff that helps you feel good. Put that into your calendar and just do it. Sounds very simple, right? It is very simple, and it's also very powerful. So that's usually prescribed, and CBT. MBSR is mindfulness-based stress reduction. Interpersonal therapy, basically all these things have been found to be very, very helpful when it comes to cancer treatment. And another very similar guideline, this is from ESMO, the European Society of Medical Oncology, also basically saying the same things, dealing with psychosocial factors. Carlson talks about mindfulness, showing that mindfulness helps to basically break the cycle of feeling vulnerable, feeling, oh no, this is a death sentence and things like that, to focus on the present and to reshape your thinking into more beneficial type thinking. It's also been found, show this, I think it's the next slide, so sorry. But yeah, it helps to short circuit, this is the thing. The consequences, psychosocial has been very positive, and in some cases also, it has shown significant effect on biomarkers. That's amazing, isn't it? It's like mind over matter kind of thing. So, tons of literature to support. I should just speed up a bit, sorry. These are the references, I'm not done yet. These are references for you. You can take a picture if you want, but again, I can send to you. Or just link up with me on LinkedIn, I share with you. Yeah. Beyond mental health, what do we do? Just one more slide left. Yes, so many things we can do. Patient, caregiver, healthcare professional, facilities, infrastructure, all in the system. Patient, what do they go through? Self-concept gets negative. Sexual dysfunction, their relationships change. Friends dating who are friends may not become friends anymore. Right? Occupational change, they may not be at work anymore. Of course, financial distress is a huge thing. Body image disturbance, especially when cancer affects the way you look. Even after recovery, it is still an issue. Right? Emotional distress, definitely. Mobility, independence. You lose this, and this is a very annoying thing to lose. Try being on a wheelchair for one whole day. Ooh, annoying. Right? Transportation problems. Healthcare professionals, compassion fatigue. Communication factors, do they know how to communicate or not? Are they comfortable communicating? If not, then it's going to affect recovery and treatment. And so many other things, prejudice, stigma, burnout in caregiver, domestic responsibility, who's going to do them, is where practical help comes in. Social isolation for the whole family happens as well. lower quality of life as an outcome. Even access and acceptability of treatment can be an issue. This is where public health comes in. Do we have the facilities, infrastructures? Yeah. So look at these people for more ideas. Main questions, who can help with all these issues? Doctors not enough, nurses not enough, social workers not enough, you don't even know who they are. Right? Occupational therapy, who? Counselors, not enough. Psychologists, largely not enough. And I'm told time's up because time also not enough. Right? So summary, this is the summary, it is multidisciplinary. It takes a village, all of us. Yeah, everyone. Teach your children, put all this into the school curriculum, how to help people with health problems. So that children, when they grow up, they don't have to worry about getting a job because they have got the skill already to offer to be useful people in this society. You think about how to find job, stress only lah, just do something first, right? It's beyond biomedical, beyond the disease model. It is psychosocial because we are people. We are not diseases. We are walking diseases sometimes, but we are not diseases. And it is beyond mental health. It's in the community. All our roles are interlinked. So, thank you very much.